At the end of this video, you will get a very broad understanding about what kidney stones is. So in this video, we will be looking at the causes of kidney stones, signs and symptoms you will notice when you have kidney stones, some investigations to be done, treatment of kidney stones, and then how to prevent kidney stones. My name is OWUSU KOJO Emmanuel, a physician assistant by profession and then a minister of God. Here on this channel, I provide health tips which will go a long way to help you in order to live a very healthy life and also share with you the word of God. Just as I always tell my viewers and subscribers, if there is any health topic you would want me to make a video on, feel free, drop it in the comment section. I'll be very glad to provide a video on that. Also, if you have been diagnosed of kidney stone before, or you know of a relative or a friend who have been diagnosed of kidney stones before, share with us the experience in the comment section. If you have not subscribed to this channel, then kindly subscribe to this channel for more videos and then like this video so that it will send a signal to the YouTube algorithm to share this video to many people. Now let us continue. The kidney is a very vital and essential organ in the human body, and a major function of the kidney is to excrete waste products from the body through the urine. Inside the urine are certain crystals. These crystals include calcium, oxalate, and uric acid. When the urine becomes very concentrated, these crystals come together and then they form a stone. I hope you understand. So basically, this is how kidney stones are formed. For you to experience signs and symptoms of kidney stones is dependent on the size of the stones formed. So this means that if the stones being formed are small, you might have the kidney stones, but you will not show visible signs and symptoms of kidney stones. I hope you understand. However, if the size of the stones being formed are big enough, and when they try to pass through the ureter, you begin experiencing some signs and symptoms. So these are the signs and symptoms. First is lower back pain. You will begin experiencing back pain, which sometimes radiates to the lower abdomen. You also notice blood in your urine, and also you might experience nausea and vomiting. To some extent, in its severe form, you can experience fever. When you begin experiencing fever, this means that infection has set in, and with that one, it is an emergency. I hope you understand. There's a need for draining of the urine, the concentrated urine in your kidneys. So now, what are the risk factors of kidney stones? Studies have shown that if you know of a relative, if you have a family history of kidney stones, it is likely that you too can get kidney stones. So this means that if you have a relative or a family member who have been diagnosed of kidney stones before, it puts you at a higher risk of you too having kidney stones. I hope you understand. Then the next thing is dehydration. If you're one kind of person who doesn't take in a lot of water or fluid all the time, it makes your urine concentrated and it predisposes you into having kidney stones. The third thing is intake of high amount of protein diet. If you're one kind of person who takes in a lot of protein diet, it puts you at a higher risk of having kidney stones. What are the investigations to be done in order to know that you have kidney stones or not? When you begin experiencing these signs and symptoms, urinalysis is first done. For the urinalysis, we will look at blood in urine. You will notice whether there is blood in the urine. After the urinalysis, ultrasound is also done to rule out the stones in the urine. If the ultrasound is unable to pick the stones, then you go extra mile to do CT scan. Okay, for the CT scan, is able to pick the smallest amount of stones. However, if the stones are big enough for the ultrasound to pick, then an X-ray, abdominal X-ray is also done to know the exact position of the stones. So now the big question is, how do you treat kidney stones? Basically, there are two modalities when it comes to the treatment of kidney stones. We have the conservative management, and there are also some ideal medical procedures that are done specifically for kidney stones. These include sound wave lithotripsy and then ureteroscopy. Whether it is conservative or surgical, it depends on the size of the stones. So if we take the ultrasound, or we do the CT scan, or we do the urinalysis, and it indicates that the stones is small enough, it's very small, what will be done is pain management and hydration. So this means that because you are in pain, give you pain medications. I hope you understand. These NSAIDs, these analgesics to calm down or reduce the pain you are in. Then we will encourage you to take in a lot of fluids or water so that you'll be able to urinate all those stones, small stones out. Ideally, in a day, you should take in about 3 liters of water. 3 liters of water. Ideal medical procedures that are done specifically for kidney stones. We have a sound wave lithotripsy and we also have uteroscopy. So for these two procedures to be done, then that means the stones, the kidney stones should be big enough. I hope you understand. If the stones is small, there is no need for this procedure to be done. With the sound wave lithotripsy, a beam of wave is targeted at your back where the kidneys are located. then they will radiate those beams into your kidneys, and that will break down or dissolve the stools, and you urinate it through your urine. And with the ureteroscopy, a scoop or a tube is passed into your kidneys, then they will pick the stool and then they will bring it out from your body. So basically, these are the two procedures that are done if the stones are big enough. So now let us look at the prevention of kidney stones. How do you prevent kidney stones? Just as I said, it comes as a result of concentration of the urine. So one thing you can do is to always hydrate your body. If you stay away from fluids always, it makes the urine concentrated. As a result, this calcium, oxalate, and uric acid will come together and form the stools. But when you take in a lot of water, you always dilute the urine. Hence, there will be no formation of kidney stones. Also, taking in high amount of protein diet, you should reduce the intake of high amount of protein diet. That one too will go a long way to help you if you want to prevent yourself from kidney stones. I hope this video is very helpful for you. Subscribe to this channel for more videos, like this video, and then share this video to many people as possible. And there are many people having these signs and symptoms. However, they don't know that it is kidney stones or not. They watching this video can give them a clue that they need to go to the hospital for further investigations to be done in order to know the best management procedure for them.